Welcome everyone to today's podcast. Today, I'm going to speak to Svetlana Rilkoff. Now, she is a former Canadian trained registered nurse of 25 years. She's upheld to the do not harm promise and was terminated in 2021 for refusing the harmful C19 vaccine. At that time, she started Ezra Healing, the new wellness paradigm model that helps people transition from the old medical model to the solutions of focus model. She's passionate about disease prevention and health promotion. Her clients include beautiful people who have received the C19 vaccine and soon developed turbo cancer. Women with breast cancer is a common presentation in Svetlana's wellness practice. Providing emotional support with winning healing solutions, we are seeing women with breast cancer recover in their 2.0 life. Having said that, welcome. Welcome to our podcast.
Thank you, Grace. It's so good to be here from Canada to Australia. And it's just amazing to have this technology to be able to connect and be relatable in the past 5 years specifically.
Absolutely, I agree with you. We were just sort of talking off air just before, and there is so much that we want to, sort of make sure that our listeners and our viewers, understand where we're coming from with all of this. But I really want to start, I guess, with that moment that you're not a you're not someone who has breast cancer, but you work with women with breast cancer. But I want to start at that moment because what we want to talk about is vaccines and how years ago during the C19, they were promoting this vaccine, especially these particular vaccines, and what you've seen. So take us back to that moment and what made you say, look, like you said, you took pretty much an oath, didn't you, as a nurse to, do no harm to patients. And then we hear of all the things that happened in hospitals and clinics around the world. So take us through that moment where you were terminated and then take us forward from there.
Yeah, it would be an honor to relive that. And I think most of us, if not all of us, if we've been on the planet for the past 5 years, we all remember when. We remember when we were faced with certain decisions that were, seriously life altering. And there were many of us paying attention at the time. So, in 2020, in March of 2020, there was an announcement of the pandemic. I call it the pandemic because 2 weeks into it, I was really starting to see so many red flags. I was at that time working as a registered nurse in a doctor's office. And very shortly after the pandemic was announced, we had a billing code in our office for our electronic medical record to bill COVID-19. And in Canada, it takes months and months to create this billing code where our medical services plan, has it approved and it's attached and sent down to all electronic medical records in the public healthcare system. But literally 2 days after the announcement made by Justin Trudeau, we had a COVID-19 billing code. And I just thought, wow, like for such a sudden onset, a surprise of a virus, how is the government already organized and has their billing codes all ready to go for the doctors to bill the government? And that was just, it started to move me. And I started to become, this investigator, nurse reporter. And the more and more I got into this, the more I found it to be so strategically planned. And it was starting to harm people. People were calling into our office, thinking they had the virus when really they were just in panic and anxiety because they were sitting and watching their televisions, and that anxiety made them have, increased respiratory rate. So we had a lot of, panic calls. Fast forward, the mandates of the vaccines in British Columbia, Canada, was October of 2021. So if you weren't vaccinated as a healthcare employee, you were terminated. So I chose not to get it because I was seeing so much injury from the vaccine. The vaccines rolled out in the communities, in the hospitals. And obviously, I was very hesitant. I wasn't planning to take it. So I was just really observing the high rate of injury that would present in our family doctor's office. And one specific case that changed the course of my career was a 30-year-old woman, a physiotherapist, very, very healthy. She was a runner and a biker and a swimmer prior, and she took 2 vaccines to keep her community safe, as per the media. And she landed in a wheelchair 6 months after her second vaccine, suicidal. So she became paralyzed. And I witnessed the physicians really just not care for her properly. There was, a diagnosis of multiple sclerosis, MS, made, but there was nothing, there was no digging, there was no investigating of why this perfectly healthy, athletic woman would all of a sudden develop MS, a neurological disorder, and land in a wheelchair. I was seeing this in live time, and I was putting the pieces of the puzzle together, but the physicians, in my opinion, were just completely ghosting her. I'm not giving her the proper treatment and not admitting that it was the vaccines that have caused the neurological damage. And, I would see injury after injury, not as intense as that, but people who literally couldn't move their limbs, they would pass out, they would have chest pain, they would have the worst headaches of their life. And all these side effects were just coming off as, well, that's a normal part of the vaccination process. And, full disclosure, prior to that, I ran flu clinics. I gave, tetanus shots. My children were childhood vaccinated. So this was my wake-up call for the world of vaccines. And it was ever since at that point, I chose not to get it. And I was terminated in October of 2021. And I thought, man, the people of Canada, they're going to really need a resource to come talk to about what's going on here. And so I took it upon myself to create my own business called Ezra Healing. And I literally just, I got a cell phone, I got a business number. I started, speaking at as many rallies as we possibly could, as many podcasts. I was one of the biggest whistleblowers to expose the truth. I thought I was alone, but then we all started coming together and we all had the same stories and observations. So, I was married to a family doctor and we divorced over this in 2020. So it really changed the course of my life. And I also lost custody of my children in 22 because I refused to vaccinate them. In 22, sorry, I'm done now.
That's okay.
It came time where my 2 children was going to get vaccinated. And the government was really pushing for these vaccines. And I didn't want them in my children, obviously. So it was like a custody court battle. And I lost and he won, and the kids went on to get vaccinated. And my daughter got very sick. I believe that she has fertility problems now. You were talking about that. So it's a rampant syndrome that we're going to be seeing for the next probably 10 to 30 years in terms of, women and their fertility issues.
Yeah. I was just going to also say too that a lot of people, and I appreciate you, you sharing that, that moment when everything sort of came out and how it was quite interesting how everything was done. We all know it takes years to create a vaccine for certain things, and you're going to make sure that the virus itself is contained first before we do all of this. And here they are who already, like you said, they've already got billing codes and they've got all of these things put into place. And you sort of go, well, if this is something you didn't know about, it's interesting how you were on the ball. But that's the medical side. But on the this physical side of the people that did take the vaccine, it had, like you said, it caused a lot of issues. It caused a lot of injuries. Now, I remember when I first heard about all of this, and we were speaking about it before, and I, like you, did not take the vaccine. I went and did my homework. People would call it conspiracy theory. I call it reading. And that's what I did. I looked into it as a breast cancer survivor. I looked into it and thought, what are the pros and cons of this whole, C19 and the vaccines? I wanted to know the whole thing. And as a breast cancer survivor, I decided not to take it because for me, it was the right thing to do. Um, and then you hear about these injuries. And I remember at the time, like you said, yes, you heard about the injuries of the people come in, their limbs are hurting or they're fainting. And I remember hearing people going, I didn't faint. I didn't have any limbs issues. I didn't get a headache. And it's like, it's not
And I
about
say,
then. It's about
yeah,
now. It's the after effect. It takes a little bit longer. But now, you know what they call it? I don't know if you've heard this. They call it long COVID. It's like,
I've heard
no,
that.
it's an injury. Stop
Yeah.
creating words just so you could feel better. So a lot of people were, like you said, it's not the then, it's the now effect. And I think it's really important that people are aware. We're not saying all people, because God forbid, you can't kill everyone on the planet. But at the same time, there are a lot of people who are going to get injured, and it ain't the day after, a month later. It's now. It's 2000, from 2002 to I think now is I'm hearing all of the injuries turning into things that are worse. So continue with your story. I just wanted to sort of mention that as well.
No, I love that, Grace. So after basically my entire life was shattered because I said no to the vaccine, it was really time to, put this into high gear and create something more formal, because that's exactly what happened. These injuries, not only did we see physical injuries, but an injury of the soul. I'm going to say there was a rape of the soul, because I haven't met one person, and I speak to many people, that wanted to take the vaccine. There was always like, I took it because to travel, to keep my, to keep my marriage, to keep my job, to, visit my dying grandmother. There was always, an excuse outside of them. So, there was a rape of the soul. And that's why I think this is such a very hot topic, because it goes as deep as our soul. And there was a freedom to choose. There was many of us that didn't choose, so we definitely paid the consequences. I don't think there was a winning solution on either side. And that vaccine was created to divide, and it really, really did divide people. But the silver lining, I always like to look at the silver lining, is that there's a lot of healing going on now, and there's a lot of connection. I mean, it's an honor to meet you, Grace. If COVID, the pandemic, never happened, I would have never met you. And I will always say, I'm actually really glad COVID happened, because we were obviously living a lie. We were on a medical platform that was truly causing us harm, not just the past 5 years, probably the past 150 years. So the Great Awakening is truly here. And it's now time to uncover, what has been the normal. For example, we're talking about breast cancer, cancer treatment, even the diagnosis of it. And, what do we know about it, and how could we do it better? So I'm super focused on solutions. And, when I saw the disaster happening in my own industry, one, did I feel betrayed, because I went into nursing to really help people. But soon I woke up and I thought, I'm just a warm body for the medical mafia that's just using me. And no wonder I couldn't talk about exercise as the best medicine. No wonder I got in trouble every time I suggested somebody losing weight, no, because that was never for me. And as soon as I was terminated, I had this huge relief, thinking, thank God I can finally practice how I've been wanting to practice all my career. So, there's a lot of blessings in this, but there's a lot of people, and this is the worst part, that got really, really hurt. And this really bothers me. And this should bother every person on the planet, no matter if you're physically injured or not, no matter where you are, if you got the vaccine or not. I think this should really bother people enough to, be the change you want to see in the world and speak up and not bow down to, any sort of government, any sort of authority that doesn't make sense. We need to be questioning everything now, and that's called good science. So, if we want to, there's thousands, hundreds of thousands of us creating a new wellness paradigm. Grace, you're part of that. And there's two worlds now. And you get to choose which one you want to live in. And that's what I love about freedom to choose.
So true. I like the way you said all of that, because it is true about, I think in a way, like when you said it's the soul, it was because it wasn't, a lot of people, it's not just about my body, my choice. It goes even deeper to that. It's your own morals, and to be questioned, you have to, as opposed to you could. And I know that you had a choice, but really all the people, I would say 90% of people that I spoke to said, Grace, I had no choice. They are the first words they use. Grace, I had no choice. I had to take it because I need to work. Grace, I had to take it or else I wouldn't see my father. Grace, I had to take it because if not, my kids couldn't go to school. So even though it was like a freedom of choice, it wasn't. It was deeper. It's on a deeper level. And I believe in my hallucination, and you'll hear me say a lot of that. It's always my hallucination, is it was good against evil. So what happened was the people like yourself who were in that medical field, yeah, you could speak up because you have the experience. I don't have the experience. I'm not in the medical field. But what we'd say to people who were barking up and starting to put all this, stuff out there, yes, it was good to put it out there, but most of us said, you know what? Let's just be here and let the people come so we can help them. Let's
Hmm.
not try and fight these evil people. Let's just be here. So when people come, we open our hearts, we open our doors, and we say, right, we get it. We don't discriminate. We're here to help. And that's what I think most of the people that I know of we were told in an unconventional way, I guess, is just to sit back and just wait because the people will need us. And with yourself speaking up, like you said, a whistleblower, you needed people like you, not like me. What would I know in the medical field? I don't know anything. So I'm not going to start opening my mouth. Oh, did I know the? No, but someone who's there, that's where you got to listen. And you have the firsthand experience of, like you said, you're in the medical field and you even saw yourself how you were even saying, lose weight, do some exercises. And it was a big fat, oh, don't say that. You can't say that. Why not? Why not?
Mhm.
Now, you know, the thing is, and going back to your family, as well, is, you try and do the good for people, but you're always going to find those people who are going to go, you don't know anything. You don't know anything. I'm going to do it. And it's like, no, I do know. I do know. And now you're not sitting here saying, I told you so. You're sitting here going, like I said before, my home's open, my heart's open. How can I help you? And I
That's right.
think that's really important for people to know. We're not here to judge whether you took it or not. But if you have an injury, we're here to help you. We're not here to, discriminate you. We're not here to say, I told you so, or point the fingers or things like that. Because I know back then that they would say that unvaccinated, but the vaccinated wanted the unvaccinated to die. But now the unvaccinated hopes you don't die.
Mhm.
That's the thing that I think is really important. We're not here to judge a person on that matter. But just going back to it, like, because we're talking about the C-19 vaccine, and it's really important to people understand that, again, we're not saying, I have this, call it a conspiracy theory. My hallucination is, and I'm hoping, I could be so wrong. I'm hoping that half of the vaccines that came out of a particular company were, what do you call it? Saline? Like it's water, like it's nothing.
Saline.
Yes, and the other half were. That's what I'm hoping in my hallucination, because I'm thinking, please don't tell me that if you've vaxed, I don't know, 20, 200 million people around the world, they're all going to have an injury. I'm hoping that 100 million were, how do you say? It was like when you don't know. I'm not saying the word properly, but when they give it to you, you don't know if it is the vaccine or not,
Like
or a
a police.
placebo.
Well,
Yes, yes, things like that. I'm hoping. But having said that, we're going to talk about the people that are injured, and especially because we're here to talk about, cancer. Cancer is growing. I remember saying, and it's quite interesting. I want to say this point because I remember back in the days, back in 2021, 22, I remember my breast surgeon saying to me, "Oh my goodness, there are so many more women coming to see me." And I asked her the question, that was back then. I should ask her when I see her next week again. And I asked her, "What do you think that is?" And she sort of said to me, "I believe it's because we were locked down, people weren't doing their examinations." And I thought, well, that makes sense because we were the most locked down state in the world, not country. The state of Melbourne was locked down the most around the world. You can Google that. It's true facts. Um, we're almost shut down almost 200 and something days out of a year. So she said it's because they didn't do their follow up. I did my follow up. I couldn't care. My husband couldn't come in. He had to stay on the phone in the car park. I went in. I could not care. I need to get this checked. Having said that, now that she's busy with breast cancer patients, do you think that it has something to do with the C vaccine and the turbo cancer that we're hearing about? Is that a
I don't know.
possibility?
It's a very strong possibility. And the more and more I get into this, each day that goes by, I believe that we are seeing, we've always seen breast cancer, but why are we seeing an exponential increased amount of breast cancer post-vaccine, which we've determined or labeled as turbo cancer, so fast onset of cancer post-vaccination? Why is that happening? What I'm observing, and I'm just basically a scientist in this, brainwashing experiment here. What I'm observing is when the vaccine went into the body, it produced an inflammatory response. So something called a cytokine storm, just a mass amount of inflammation happening in the body. And, some people did fairly well. Their immune system was quite strong. It fought it off. It did its thing. And there were a lot of other people that didn't fare so well. I would say it seems like 80% of the people who took the vaccine in my world had some sort of negative reaction. And a negative reaction could have, everything from numbness and tingling in the injection site to loss of vision, loss of taste, hair falling out, inability to walk for 3 days, some sort of neuro deficit. It could have been even chest pain within 6 months of the injection, to just not feeling right. People are just, explaining to me since injection, there's just something off about their health. It never was like that before, but it's like that after. So I think we can really conclude based on large numbers that post-vaccination, most people did not fare well. So it seems to be in the cells, in every cell of our body. We examined the vaccine in 2022, Dr. Nagasi and I. He is a family ICU doctor here in Alberta, Canada, that was fired for one, not taking the vaccine, and two, prescribing ivermectin to his ICU patients. So he's a scientist by trade as well. So I got a hold of a bunch of vaccination I gave it to him. He looked at it under a high-powered microscope at a university lab, and he found moving things in the vaccine on multiple vials. Things that, were very foreign. Like, why would something that looked like a parasite be in this vaccine? Because we were really curious why so many people were having such negative reactions. So, concluding from that, we could say that there was some sort of either AI or naturally occurring organic parasite, or just a completely foreign body that looked very like had tentacles. They just looked like something you'd find under the ocean floor, which really kind of makes sense now, 2.5, 3 years later, that we're seeing all this turbo cancer. So we really have to ask ourselves, what is cancer? Like, we've just been using the C word for our entire life. But when we actually ask ourselves, what is it? Well, our definition is like, well, whatever the pathologist says. And the pathologist has these, like plethora of different stages and fancy names. And so, ivermectin is an antiparasitic. Why did they ban an antiparasitic in 2020? Was it because they knew that we were going to have this mass parasite infection based on the parasites that were in the vaccine? Possibly. It sounds like a movie, script, but that's exactly what we're living in. It's the Matrix. Somebody wrote this movie script for us. So, there was a lot to unpack with this information, and we just kind of we did the experiments, we did the investigation, we noted it, we talked about it on podcasts, and now we just get to put the pieces of the puzzle together, which we're going to be doing for the rest of our careers. So I think the whole turbo cancer post-vaccination, I believe, is most likely a parasite infection. That's why things like ivermectin and fenbendazole, mebendazole, are really working in combination with, a dietary change and high doses of vitamin D. So it's, it begs us to ask, what has been cancer our entire life? We've talked about bacterial infections and viral infections our entire life, but do we ever talk about parasite infections? No, because maybe has it been the silent killer all along? And now we are just coming into this understanding based on trial and error. And what I like about what's happening now is this is the real science. This is, real practitioners based in truth and integrity, working with real patients, and we are reporting real data. So it's a really fascinating, not boring sort of work. And it's really interesting, to know that I've made a career out of helping people with vaccine injuries. And I believe cancer is a vaccine injury, many of it. And that's what we're seeing now, including the breast cancer. And I really, out of anything at this talk today, I really want to focus on women who are maybe fearful of getting breast cancer, perhaps maybe because it's a genetic thing in your family, which I don't believe this whole genetic thing is real. Yes, you share the same food and the environment and water with your family. Could that be it? And an environmental, similarity? Um, you know, Speaking to women that, go for their yearly mammograms, they are hunting. They are hunting for something. And eventually they're going to find something, because that's what the medical system does. They're there to find something and offer a solution. And it is most often the solution that is the problem that causes you the pain and suffering. So we're in this cancer campaign. We were born into it. I think October it is here is Breast Cancer Awareness Month in Canada and probably the world, and wear your pink ribbon. And that's kind of where I wore pink today, right, to honor the breast cancer, because we're going to be turning the ship around. And it's definitely one of my passions to help alleviate and de-escalate the fear around breast cancer. And I think there's a lot of unnecessary routine screening that goes on that shouldn't be going on anymore. I've noticed that biopsies seem to be causing the metastases. And often these biopsies are not simple procedures. Maybe they're explained one way, but then they go in and literally these women are coming out, maybe with 2 or 3, 4 stitches, and then they develop an infection. Some women are being offered, preventative mastectomies. Some are actually going for it because the fear that's put into these women at the doctor's visits literally throws them into the cancer, chemo, radiation, surgery funnel out of fear. And they'll just going to mutilate their body, thinking that they're going to do the best for themselves. I have one story that just popped into my mind. A young 40-year-old beautiful woman. They did a biopsy, diagnosed her with stage 3 breast cancer with a big, long, fancy name. She got 8 rounds of chemo. Uh, After that, it didn't go away. And the doctor came back to her and said, "You know what? Darn, I read the pathology report wrong. You didn't need the chemo in the first place." So she got 8 rounds of chemo. She had 2 young kids. It took her like 6 months. She was super sick. Her hair fell out. And then that's what the doctor had the nerve to say to her. "You know what? Sorry, but I made a mistake. That was the wrong intervention. Darn." So, these doctors, not all of them, but there's a lot of kind of nonchalant sort of attitude going on right now where they're playing with people's lives. They're giving people time limits on their life. And, when you have a person already in a state of fear and panic because of the whole breast cancer word, and then you add a timeline on their life, well, you know what? That's often actually what's going to happen. There's a mindset. So, what you start to believe and think and hear is what you are going to feel, and you're just going to attract your destiny, essentially. So I think there's a lot of, things that we don't need to do as women anymore. And that's one, routine mammograms. I think that does a lot more harm than good. I think mammograms actually cause cancer. So I've never done one. I'm never going to do one. I always like to say, how's my body feeling? If there's something wrong with my body, for example, the nipple is full of discharge and it's hot and it's oozing, there's something obviously wrong with it. Yeah, let's get it checked out. Let's do an ultrasound diagnostic on it. Let's take a swab of the fluid. Let's send it away. Is it growing maybe bacteria? Like what's going on? That's different than I feel perfectly fine. You go in for a routine mammogram, they see a shadow, and then they do like a routine preventative biopsy. The biopsy comes back as stage 2 breast cancer, and then they're pushed down the chemo and radiation surgical funnel, and literally their life has been forever changed. So, it's starting. I say you can always do it, but you can't take it back. So there's no rush. Let's just slow down. Let's just talk to some people like Grace in Australia and Svetlana in Canada, and let's start asking questions. You also may have had this lump in your breast for years, and they just found it on a routine diagnostic. So, why disrupt the apple cart when we don't need to? All we have to do is ask the right questions with the right people and check in with our intuition, because the answer already is inside of us. And this is what I really like to do with my clients is I like to focus on their journey of how they got the diagnosis. And it's so often in that storytelling that we find out people should have never been diagnosed with a certain condition. Women should have never, ever been diagnosed with the breast cancer word because nothing was ever wrong. So we just have to continually ask and ask questions. So if you have a family history of breast cancer, let's not make any radical decisions to remove your breasts, not a necessary intervention. If you have a lump in your breast and the doctor is suggesting a biopsy, I personally don't recommend biopsies. I believe that they do more harm than good. If you're presented with a chemo and radiation option, let's look at some statistics as well. What is the success rate of chemo and radiation? I think it's under 5%. And should that success be, counted towards the medication or maybe some other lifestyle choices that you made? So it's just time that women started talking about this because I've seen so many women be forever mutilated. especially with the surgical intervention, that it's really hard to go back after you do that. And I just want to prevent pain and suffering, and especially regret. To carry that regret forever is a journey of traumatic healing. And, possibly, I always like to talk about previous, trauma as well. Could it be stored in a certain body part? And is that why, maybe we're developing these lumps? But specifically, what I've been finding post vaccination is the turbo breast cancer, which there's a solution for, because it's looking like this turbo cancer is a parasite infection. So if we just deal with the parasite infection, then the tumors or the cysts go away. And the actual tumor is your body's way of collecting garbage in your body. And once you open that nice capsule up, everything else just flows out. So if we just do some, dietary changes, including, reducing carbohydrates, cutting out all sugar, including alcohol, because alcohol turns into sugar in your body, and carbohydrates count as sugar because whether it's breads, pastas, cereals, your body still interprets that as sugar. So the parasites like to feed off of carbohydrates and sugar. So cut the fuel off for the parasites, and these tumors start to go away and shrink. Incorporate, medicines like antiparasitics, like ivermectin. Most of us have heard about ivermectin. Full disclosure, I never heard about it before 2020, ever. But all of a sudden, it's this hot topic. So I went on the deep dive. It seemed to be helping people with the bioweapon. It seemed to be helping people with the long haul. It seemed to be helping with neurological disorders and vaccine injuries. And now it's helping people with cancers. And not only are people feeling better after a good dose of ivermectin, maybe, after 3 months, but their actually tumors are shrinking based on scans, because a lot of these people want to do, perhaps an anti-parasitic protocol, but still keep their family doctor around, possibly even the oncologist, to do scans and repeat scans, because a lot of people find comfort in a diagnostic scan. Again, I'm not the biggest fan of diagnostics. I say, let's just start listening to our body, and our body's just going to tell us if we're getting better or not. But it's always fun to have a scan if somebody wants to do it, and we get to see these tumors shrink. High doses of vitamin D are really important. Like I'm talking between 50 to probably 60,000 international units a day is really, really important. We're also doing a procedure called EBU. It's a blood cleaning procedure. Essentially, it's dialysis, where you're hooked up to two sorts of IVs. The one in your right arm is letting your blood out slowly. We're putting it through a filter. We're taking the spike proteins out. We're taking out the cancer markers, the parasites, the heavy metals, and we're putting ozone and oxygen in it, and we're giving it back to you. So it's just detoxing. I think everybody on the planet should have this procedure done at least once. It'll be interesting to see if we can find an EBU machine in Australia. There's about 60 in the US. There's about 2 in Canada. We want to open up a third one. So, yes, we're seeing this. This is the real epidemic, the turbo cancer. And I would say breast cancer is number one that I'm witnessing. Colon cancer is number two. Those seem just to be the top two. We're always seeing something every day. So, if you have obviously something very, concerning about your anatomy of the breast, go find a trusted healthcare provider to do more investigations, 100%. If you are being hounded by the medical system to do routine screening, I really want you to think about that. If it's for you, start trusting your intuition. You're smarter than you give yourself credit for. Step into who you really are as a divine feminine woman. You don't need a medical system to tell you how your breasts are doing. You really don't. You're just check in with your body. Remember who you are. So this is a little bit about my practice with breast cancer, and we work with an oncologist and other oncologists from Canada who are on these same sort of protocols, and we just do a lot of cross referrals. And we're seeing more women talk about their cancer journey stories, and a lot of women who are now starting to refuse mammograms, refuse biopsies, refuse, prophylactic mastectomies. So it's really exciting to see more and more people don't want to do chemo, they don't want to do radiation. So this is the empowering part of, people leaving that medical mafia system into the new wellness paradigm. But it's taken us this far in order to cross to the new one. And I guess that's just how we had to do it as humanity.
Yeah, wow, that's I thank you so much for, sharing all of that, because it was just amazing, from the moment you said, the fear that they put in you and things like that. Unfortunately, some of the women that I interview on my breast cancer channel, they don't really sort of talk about it on air, but afterwards they would say to me, I really didn't need that mastectomy. I really didn't need that lumpectomy, because then I remember one who was stage one. It was so tiny that she had a mastectomy done, and then she went through the radiation and all of that. And she said to me, "You know what, Grace? I don't think I needed to do that." And I said, "No." I said, "If you were really, really concerned, you could have just done a lumpectomy and taken node out just to make sure." I said, "And then you make your decision." And I'm so glad you brought that up as well, because that's what the system does. The system comes in and goes, "Oh, you need to do this, because if not, we need to get on top of it, blah, 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 because if not, you're going to die." My own experience was that. My own experience was, I'm going on a routine check all the time, since my mum passed away in 2013. I'm going, yep, see you next year, see you next year, see you next year. MRIs, by the way, and ultrasound. I don't remember doing hardly any mammograms, but the other two. And then one year I get, "Grace, we found something, got to do a biopsy." And I remember thinking, "Oh, okay, do the biopsy. Yes, it's cancer. Great. Not great, but great. I know what it is." And I remember her saying, "I've got to do an auxiliary. If I can't find your lymph nodes, I've got to do an auxiliary clearance. We're now going to operate on you." And my husband said to me in Italian, stay back, take a breather. And I remember looking at him thinking, "Are you crazy? You're going to get this thing out of me." And he said, "No, no, no, doc, can we have a week?" She said, "You can have 2 weeks." And that's what I did. I pulled right back. Then I went in asking questions. "No, we got to get it out. We got to get it out. We got to get it out." What did I do? Go for a second opinion. Cut a long story short, went through all that process. I remember going for a checkup, probably, I would say, let's say 2020, 2021. And my doctor says to me, "Why didn't you get this taken out, Grace, in 2016?" Now, I was diagnosed in 2018. And I looked at her and I said, "What are you talking about?" She said, "Grace, this has been in you since 2016. Now, it was so small that I don't even know, I couldn't even tell you how many millimeters it grew, because it didn't grow rapidly. Now, I did decide to do, again, this is disclaimer, I did the lumpectomy. But when I did the lumpectomy and she did a 10 centimeter auxiliary clearance, she found nothing, right? So then
10
what did I do?
centimeters.
Sorry?
Insane. 10 centimeters.
10 centimeter auxiliary clearance and found nothing. So I was like, "Okay, let's move on." Then she says to me, "Go and see a radio. I need you to go see a radiologist and an oncologist." And I said, "All right, let's do that." I did that, not because I wanted to do it. I went in with all my homework, my questions, like you said. You don't just go, "Oh, so doc, is this going to hurt? Is my skin going to wrinkle?" No. Is my hair going to fall out? Are my nails going to fall out? Are my eyelashes? Don't ask these questions. The questions you got to ask is, "So can I see someone who's done the same treatment, who's been in it for 5 years? Can I get to know a person like that?" They will tell you no. Straight away. No, no, no. Patient confidentiality, right? Guys, go on Facebook. Everyone loves to share their story and they'll tell you. Then you say to them, "Well, what's going to happen in 5 years from now?" Well, there's a chance it'll come back. My disclaimer, I got told there was a high chance with the radiologist that I will get, because I was on the left side, I will have heart issues. I got told that there's a high chance of a secondary cancer, and there is such a low chance of my own cancer coming. And I can't remember all the other questions because I had more than 20, that the pros were this high. Sorry, the cons were this high, not the pros. The pros were so low that he turned around. The radiologist said, you know what, in your case, I wouldn't even do radiology. And I thought, thank you for being honest. Go and see the oncologist. She says to me, she puts it in her little diaphragm there and her stats and all of that. And she says to me, you've got a choice. You could do tamoxifen. Now I was 47 at the time. You could do tamoxifen. Right. What are my other choices? Get a hysterectomy. Get a hysterectomy. What does that do? Oh, well, that'll put you in early menopause. But what are the side effects of that? Well, you can have heart failures. You can have a heart attack. You can have problems with your hormones, blah, 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 blah. And you can get a secondary cancer from the tamoxifen. Well, I don't want tamoxifen and I'm not doing a hysterectomy. What other options do I have? You don't. But in 5 years, there's a 0.08% chance of you getting the cancer back. But in 5 years, there's a 0.8% of you getting a secondary cancer on tamoxifen. So I took my chances and said, you know what, I'll take that 0.08 and I'll do nothing. I said to her, I'm going to start doing some holistic protocols. These were her exact words. Get out of my office because I don't have any more time for you. So that is a true story. That's my story. Now, I remember saying to her, wow, thank you for letting me see who you really are. And I say it in all my podcasts. Where I went is called Peter Mac here in Melbourne. My mother went to Peter Mac now more than 40 years ago, when she had a tumor. Peter Mac was so tiny that the room was I think my powder room was bigger than that room of my mum's. Because why? They were dealing with the cancer. If you go to Peter Mac today, it's almost like the 7-star hotel in Dubai. And I thought, the money isn't going to the patients. The money is staying here. And it's caused, like I was sitting on this plush couch. Who cares where I sit? Right? So what we're saying, and I'm the first to say it. I'm not here to say don't do chemo or radiation, but you ask the questions. Where am I in 5 years? Where am I in 10 years? Because unfortunately, I've got women who I interviewed back 3-4 years ago. Grace, I've got it now in the bone. It's metastasized in the bone. Grace, I'm living now with an incurable cancer. Do you know how many women I have now tell me that? And it's like another one. So this is why I want to share this, because it's really important that people understand. It's not that we're not saying don't go and see a doctor. You know what? You break your leg, great, go see a doctor. You need to get an x-ray. You need to put in plaster. But like you said, if you know your body better than anyone, I was actually feeling, if anything, at the time that I was diagnosed, I was feeling on top of the world. I was actually feeling good. But for me, like you said, on an emotional level, on a psychological level, I was holding a lot of trauma. So this was my little wake-up call to get rid of my traumas. And I took it on board. And I went, you know what? I need to get rid of these traumas because I don't want it to create other issues. So it's really important. But going back, I always say, don't make a decision based on fear. And that's where the medical field says to you, go and do an axillary clearance. In the end, I end up getting 2 lymph nodes out and a lumpectomy. Why? I decided. I looked it up. I had my dream team. We decided, the 7 of us. But I had the final decision. What do you want to do, Grace? So it's really important that women understand that, you know, if in the unlikely case you get diagnosed with breast cancer, make sure you do your homework. Take a step back and do your homework. Like Svetlana said, reach out to her, reach out to me and say, hey, I just got told, oh, there's a lump. What's the first thing I should do? And we'll be there to say, right, this is what it's going to happen, you know, or this is what we could suggest you do. And it's only so like you are aware of your options. But having said that, and I want to get to back at that because I have a lady who's a close friend of mine who's been diagnosed with renal cancer or colon cancer, stage 4 metastasized, I think it's how you say it. And she was told 2 years, 2 years to live. Now, her 2 years expires in May this year. We took her on a spiritual journey last year in May. She is now on what's it called, ivermectin and fenzibol, as well as her chemo. Now, that's the thing I'm going to ask you in a minute, whether she should do the two together, chemo and that, or whether it's going to contradict each other. I don't know. But she was fortunate enough to get someone to, they put her friends overseas, put money together, and they brought so much of it. And they shipped her, I think, almost 6 months worth of it. So, because, and that's my second question. My first question to you is, do you believe that if you do chemo radiation and you decide to do something like ivermectin and fenzibol, if I'm saying them right, something like that, with that is good to do the two protocols? And also, do you think that once the world gets wind of it too much, they'll try and stop it? Because people healing themselves with these and not chemo radiation doesn't make money. Radiation chemo makes money. 1.5 million for 5 years for the average person in Australia will pay to do chemo and radiation. 1.5 million. That doesn't go to research, that stays in their pocket. So they're my two questions.
And they're both really good questions, and I have an answer for both. Before I answer them, I just want to talk about the whole world around diagnosis.
Mm.
Giving way too much credit to that medical system for a diagnosis. Because, for example, you do the biopsy, what comes back is a pathology report. How are those pathology, how are the pathologists diagnosing that? What's their reference chart? Their reference chart is made up of a corrupt medical system. We have to go as far as back as who created these pathology reference charts, because we're just taking that information at face value. We really don't know. Does that make sense? The whole medical system was created to set us up for failure. So are these biopsies, like, who's saying what here? And why, if say if you were vaccinated and you developed a breast cancer, turbo cancer, and you go back to that same system asking for real advice and you're going to take it, but you also believe that the vaccine caused this damage, why on earth would you listen to the same platform that caused the problem? And this is where we really need to just stop for 5 seconds. You trusted the system enough to take the vaccine. Okay, done. You developed a turbo breast cancer. Okay, done. Why would you go back and circle around back to the same place to ask for help and now get answers that are based in truth? I don't think so. That's how critically thinking I have become. So even the pathology reports that you get back that give you some long diagnosis that you can't even pronounce, that is what you actually have to even question. So, you know, once a liar, always a liar, most cases. The medical system has betrayed everybody. It's one big lie, and it's a brainwashing agenda. And I believe there are still good people in that system. They have a good heart, they have good intentions, but they're so brainwashed, they can't even see it. And often when you're in the thick of something, you can't see it until you're out and you're looking back in. So, if you do decide to do a biopsy, you get the pathology report back. I want you just to even critically think, because somebody's going to go hot and heavy in there. Your family doctor is just going to report a diagnosis, and bam, you base your entire future care on that one diagnosis of who knows who made that up. Does that make sense, Grace?
Makes a lot of sense. Absolutely. Makes a lot of sense. And I love the way you say that, because why would you trust them? Why would you continue to trust them? But the question I ask you is, do people, what do you do with the people that say, well, I don't believe that the vaccine has anything to do with my cancer. I think it's just happened. I don't know.
Yep. And you know what? To each his own. The awakening journey is a very individual, solitude sort of journey. And I'm not here to, debate or argue anybody. I'm just here to present the facts as I have found them. And I'll be honest, I don't see those people. I see people who are really open and ready to receive information. And that is where the real healing occurs, because it's a truther versus a truther, or with a truther. And we just talk about the truth. And I'm able to somehow trigger people's memory into the moment that they were sitting there, receiving a diagnosis. And I was like, how are you feeling at the time? Because it's in the feeling that we can recall moments that we can recreate. We can recreate that story. Because if you went against your intuition, then we have a problem. And integrity is what's happening on the inside is matching on the outside. And if you have a disconnect of your integrity, for example, if you're feeling like, no, that's not me, that was wrong, that's not the right diagnosis, but your doctor's telling you one thing, and then you decide to go on the recommendations of what they're telling you, you have a disconnect, and you will have guaranteed no healing. Why? Because your body is in disharmony. So, getting into the renal question, and ivermectin and fenbizanol, those are, very potent antiparasitics. So I think, if I recall the question, is ivermectin and fenbizanol effective in renal cancer? You know, they are.
With chemo as well. Like, yeah. Mm.
Okay, so this is my thought on chemo. I have never seen anybody say I loved chemo. It was just so much fun. I just loved it. I want to do it again. Not one person. I think our bodies, they tell us, they give us signs. If you are taking something that makes you throw up, that makes your hair fall out, that makes you just literally want to commit suicide, it's probably not the right medicine for you. Anything you put in your body should be helping you, not harming you. So I'm now a firm believer of no chemo. I think it destroys your immune system. They call it immunotherapy when they're like, no, we just want to kill your white blood cells. And once we've wiped out your white blood cells, then you're going to heal, right? It's like, how many times have we heard that? So it's like, let's just stop and think about that for a second. It doesn't make sense. There is no sense in it. So I don't see, I do see people on chemo and the antiparasitics. Do I see success out of that? Yeah, I have. But I think it's because the antiparasitics were actually doing its job, and the chemotherapy was just, it was slowing down the progress and making the person sick. And, when you have to take an anti-nausea with your chemo pill, there should be telling you something there. It's all about, stop listening to the doctor, stop listening to me, stop listening to Grace, listen to yourself. What is yourself telling you? Because when you have so many loud distractions and you don't give yourself time to sit in quiet and get the download of what's right for you, then you are vulnerable to anything. And especially the fear campaigns that are going on, you're going to fall prey. And this is where regrets come in down the road. I wish I hadn't done that. I wish I didn't do that surgery. I wish I didn't do that chemo. So, it's no problem to slow it down, to, just take note of what different people are saying, and then, retreat and really just think about it. Because your body, if you give it enough time, it's going to tell you where you should go. It literally is, your body's just going to pull you in one direction or another. It's actually that It's that obvious. So let's just, getting back into our intuitive self, that's our sixth sense. And that is what the whole matrix tries to dumb down, is our sixth sense. Everything from, calcifying our pineal gland with fluoride and glyphosates and vaccines and screen time, all that stuff, alcohol. I'm not a fan of alcohol anymore. You asked me 2 years ago, I would have said, oh, I like my glass of wine, but no more. It's part of the matrix for a reason. It's on every street corner for a reason. It was kept open as an essential service over the shutdowns. Why? Because it lowers our vibration. It lowers our a chance to heal. So I went off on a tangent, and that's what I do. But that's, because it's a good topic. So does chemo, is it either, I support the patient. If they want to do it, I support the patient all day long. I will never be a practitioner that says, if you don't do what I want to do, I'm never going to see you again. Like, never. You'll never see me that. And if you ever do, just count me out, because I'm just there as your advocate and supporter. Sure, I'm going to have my opinion, but I will never ghost you. If you have a clinician or a doctor that says never come see me again because you're not doing what I'm doing, that's the wrong doctor for you, and they actually just did you a favor. They did you a favor by saying bye. And what no longer serves you should really be cut off from your life. If it's not making your life better in any sort of way, then it's time to cut it off. We're in a season of separation now. The wheat from the chaff, the good from the bad, the light from the dark, the sickness from that from the health. So the more that you can get in tune with your body, you're going to know what to separate from. And that might just mean separating from your family doctor who gives you those fearful ultimatums. That's not real healthcare. Right, Grace?
No, it's not. Absolutely, I agree with you because, that's the same with and I'm sure I'm allowed to speak about her. This friend of mine, she was given that, 2 years to live, blah blah blah, but she believes everything that her doctor says. But I love the way you said, if your doctor hurts you, why would you trust him? Why would you trust them going forward, And I also remember a lady who interviewed me and I interviewed her. And one of the things that stuck to me for so long was, Grace, your body is not trying to kill you. It will never try to kill you. It will always try to heal you. And I thought that is so true. We got to take back and that's why I say to the women, take back that responsibility. You start driving. Because the moment you go, yeah, that doesn't sit right with me, you know you better than anyone, better than your daughter, your mum, your husband, your siblings, whoever. You know you best. So if it doesn't sit right, like you said, if you're sitting there going, this doesn't sit right with me, I think that's when you got to start going, okay, question who's around you. What are these people? Why are they pushing the agenda? And this friend of ours, we took her to Peru, like I was saying, and she was off the chemo and everything for like, I think all up, she was away, I think she says 47 days, something like that. I watched this woman go from dragging her little bag upside down because she didn't know which way the wheels were, white as a ghost, to so much color, so much life, that she came back to her doctor and she said, do you know what? I feel a bit better. I would like to take another month or two off chemo. And I have this recording because she recorded it. And then because I was still overseas. And he says, well, if you do that, you'll die in 6 months. And I thought, how dare you? How dare you?
We have a lot of physicians like carrying around their crystal ball, looking in it and saying, yeah, you have 3 months to live if you don't do chemo and 6 months to live if you do chemo. Do you know how many times I've heard that? If
Yeah.
you do, you don't. And then for some reason they have the God complex where they actually throw out a number. I mean, that baffles me. Baffles. I never give timelines on anything. How do you know? Like that is such a personal journey between, the God and yourself. No man should ever interrupt that journey. So just to be exposed to that hideous information from a trusted source is absolutely life changing. So, prepare yourself. If you go, within this system and start to go down that funnel, you have a high chance of hearing when you will die. And again, you put that in your brain, like things happen when you put things in your brain. And that's why I like to just put good thoughts in my brain because they usually happen. So I think it's a crime against humanity, that we have physicians literally giving timelines on people's lives. And this is how disgusting the medical system is right now. And it seems to have gotten worse in the last 5 years. And I think the reason for that is because the practitioners that held up the do no harm model of care, like myself and those 4,000 other nurses, and about 50,000 practitioners in Canada, we left the system because we were so disgusted with it. And, we have a lot of, I think, foreign trained healthcare, nothing against foreign trained, but there is this, when you go to, healthcare school, nursing or medical, you're indoctrinated by the medical mafia system. So you're just going to be that repeating robot with zero heart left. I think you have zero heart if you tell somebody they have 2 years to live, 1 year to live. I mean, we have only today to live, to be honest, like today. And that's why I want to make today the best possible day. Yesterday's done. The injury, the trauma, what happened is done. We all have a story, and it's a good story. Um, we have to own it, stop being a victim of our circumstance, turn the pain into passion, power, and purpose. We all have pain, and let's not get it stuck in our body to build up into a physical ailment. Let's move it through, whether it's plant-based medicine or connecting with a loved one or exercising or some sort of healthy coping mechanism. Let's move the trauma through our body. Grieving is a real thing. We should be allowed to grieve, and sometimes grieving never ends because the trauma is so intense. Um, but we can lessen the intensity by healthy coping mechanisms, right? And that's why, Grace, I really like your journey that you did with the plant-based medicine. I think 10 years of talk therapy equals one of those journeys that you did. So it's super beneficial. So turning this ship around, the silver lining is that we now have a lot of answers and we have a lot of solutions that we didn't before. So, we've all kind of come to this screeching halt in our healing journey. And now it's just time to do the work and build, what we want to see. And I'm a huge fan of eliminating all vaccines on the planet. The amount of childhood vaccines that we're being seen is off the charts. The sudden infant death syndrome, the autism, the allergies, the injury, the death of children right now is off the charts. And how is this normal? How are we okay with this? So, part of my mission is to save the children at all costs, because vaccinations start in childhood and they're normalized in childhood. Here now, COVID-19 vaccine is part of the childhood schedule if you want. So, America even has more. So it starts in childhood, and that's why all these chronic diseases, including cancer, which is a chronic disease, parasitic or not, is just part of the routine medical system, is because they got us in childhood. So as a parent, we really need to start asking questions like, do my children really need vaccines? And often the parents say, well, they can't go to daycare because they're not vaccinated, or they can't go to hockey. And I say, well, then I guess they don't go to hockey. I guess they don't go to daycare, because what's more important, your child's life or an activity? So I think even the role of the mother, maybe it's just time to start staying at home with the kids more so they don't have to go to daycare. And I know inflation and the cost of housing is off the charts, but there has to be a better way than saying, well, my child just has to be vaccinated so I can go out. And that's what I like to really end with, Grace. Not that we have to end, but we have to talk about this topic with children and vaccinations, because it really, this is the biggest crime against humanity. And it's all for the children if we don't stop now. And those kids, they're not going to be able to speak up like Grace and I will at this time. What do you think about that?
Absolutely. It's so true because the thing is too, for we sort of thought that the vaccine was sort of done and dusted. They made their millions, but they're still continuing to make their millions with all these injuries. And like you said, going back as a child, you start putting in the wrong vaccines into a child, they're going to get to an age, they're either going to get cancer, they're going to get an autoimmune issue, autism, whatever's out there. There's so many things that allergies that people are getting diagnosed with. When I grew up, I had everything. I took everything. I ate everything. There was no such thing as, allergies and all of that. But, what did I take? What vaccine? I have no idea. I think I took about two vaccines in my life when I was in like I don't know what you call it. I think I was 12 years old. I think that's the only ones. But these are vaccines that were 50 years in the making. It wasn't 5 minutes in the making. It was 50 years in the making. Can't even remember them. But they're the only vaccines I got in the sense that, and that's what I believe. I believe, in my hallucination, we thought, well, they can't make any more money off these vaccines, but they are. They are. They're making money off the system, the cancer system, especially, like I explained before. And it's, wow, I could say so much and so little at the same time, but in the sense that, you know, we need to make sure that people are aware, like you said, people are aware what's out there. And I really appreciate you discussing this because, like I said, you have the medical background, you got 25 years. You got 25 years in the making. I don't have 25 years. I'm not going to sit here and say I know what it's like. No. But like you said before, you take an oath and the people that have walked away, it's because they have integrity. They're human beings with integrity. The people who stayed behind, yes, I've got to do it like you said, got to do it because, I've got to go to work. Oh, my child needs to go to hockey or whatever it is. Where's your integrity? Where is your integrity as a human being? And then you hear of your child who can't do sports anymore because they're suffering myocarditis or whatever the case may be. And you're thinking, oh, it's too late. So again, we're not here to discriminate. If you had the, if you've had the vaccine, if you're doing chemo, if you're doing radiation, we're not here to discriminate. But I would like for yourself now, Svetlana, to actually tell people how could you prevent from getting cancer? What are some things to prevent? Because that's good to know. And are you talking about preventing cancer to people who have taken the COVID vaccine or anyone in general?
Yeah, and that's my favorite topic is prevention because why do we need to wait for a formal diagnosis before we take charge of our own health? I think everybody should be thinking preventing cancer, vaccinated or not. I think that's just time to start thinking about that really important topic. I know I do. So, some of the things that I've altered in my life to prevent cancer and just to live a healthy, optimal life. I say exercise is the best medicine. Our bodies were designed to move, and when we move, we produce amazing endorphins and white blood cells and red blood cells, and we oxygenate our bodies. So exercise is definitely the best medicine, and it's often overlooked. And people like to go to a different sort of avenue when really you're just not moving your body. So, get off your butt, less screen time, and move your body. It's simple. Alcohol has seemed to ruin so many people's health that I have, kind of drawn a hard line on this. Before it was recommended, 2 glasses of wine a day, and now it's like zero. There's zero tolerance. If you want to prevent cancer, I say cut out all alcohol. Go on a very low carbohydrate, zero to low sugar diet. Sugar is an addictive substance, and that's why it's in so many foods at the grocery store. So, really look at your diet, low carbohydrate, high protein. I'm a fan of meat, red meat, organic, grass-fed beef. So get out, support your local farmers, eliminate all vaccines. So, this whole HPV vaccine that we're seeing in the girls, and the boys here in Canada. I mean, this is going to be cancer causing, and this is going to be the fertility issue. Birth control, I think, is part of the problem as well. It messes up with the natural hormone system of beautiful, wombs that are meant to create life. So, the less is more. And we also weren't born with a medication or a vaccine deficiency. So, a lot of the pharmaceuticals that a lot of people are on are cancer causing. And we're just probably too trusting of what we pick up at the pharmacy, right? High doses of vitamin D seem to be really great at preventing cancer. The best source is natural vitamin D, obviously, of course. But if you're living in a place where there's not a lot of sunlight, take a supplement, and it should be in a fat soluble based substance like an olive oil. 20 to 60,000 international units during the winter months is, kind of my go-to anti-cancer dose. And there's obviously different supplements, but I think, it's what you don't put into your body as opposed to what you do, because I think we're bombarded by all these supplements, and medications at this time. So our bodies were just truly born to be, their own, habitat and machine. So it's just giving the right environment. Water is super important. I know a lot of the cities are putting fluoride in the water, which also calcifies your pineal gland. So really look at your water source, get a good filtration system. I think that's really important. Obviously, smoking. I mean, I don't even talk about smoking anymore because, I don't see a lot of people smoking. But, if you have a history of smoking, you're going to have some lung tissue damage and inflammation. And we do take that into consideration. I do see a lot of lung cancer, but mostly those people have had, long-term, smoking use. But I'm going to be honest, because routine diagnostics are so common in Canada and Australia, people's like lung nodules are showing up on X-ray, and maybe they've had 20-year, history of smoking, and the doctors are saying, oh man, you need to get a biopsy and you probably have lung cancer, even though the patient feels completely fine, no cough, no shortness of breath. And those nodules with the history of smoking have probably been there for like 30 years. So let's not get excited if you're a smoker. Hopefully you're not a smoker now. But, if you have some lung nodules that show up on X-ray and you're feeling good respiratory wise, let's not get too excited, right? I think staying away from the medical system is a great way to prevent cancer, because nothing will be found, because nothing is there most of the time. So, and a lot of meditation or just quiet time, a lot of eliminating unhealthy relationships, unhealthy toxic things in your life. If there's some sort of betrayal or trauma that you need to heal from, I think that's really important. So you don't have that stuck traumatic energy in your body turning into a physical ailment, because by the time you have a physical ailment, it's your body is in overdrive and you've had all the red flags. And if you actually really think about it, you're going to agree with me on that. So cancer prevention is such a beautiful thing. I think, if you've been vaccinated, I think it should be even more on the forefront of your mind. How do we prevent this cancer? Because I'm going to be honest, 90% of the people I see with turbo cancer have been vaccinated. So why not do a preventative dose of, say 20 days of anti-parasitic, if you can get your hands on ivermectin or mebendazole, right? Kill those parasites that are in your body floating around. And that's what we've determined cancer to be, is a parasite infection. So just deal with the possibility of an infection. It's easy. Let's not make it complicated with the other options that the medical system's gonna give you, guaranteed.
Yeah, and they don't give you any of the options that you just said, which is really interesting because I mean my surgeon, like going back to, them playing God, I so I like my surgeon. Like I really do. I respect her because she's very straightforward, and that's what I like about her. She's not sugarcoating it. But there was that thing say, and I said to her one time, do people come in and ask you if they're going to die? And she says, Grace, when they do that, I say, I don't know. You can walk out my clinic and get hit by a bus. I'm not God, which I liked. Having said that, when the big news came out, I'm sure you probably would have heard it in Canada, when Al McPherson said that she did things holistically, and she didn't go down the route. And I don't know if it's true that she went to 35 doctors. I don't know all of that. I haven't read her book, but she said she did it holistically. Wow, now I went to my surgeon, not because she's well known. My GP recommended her. But she comes out on television saying, you don't, she shouldn't have said that, that women should go. And I thought to myself, oh, I felt like going, Dr. Thornton, sorry, remember me, your patient? I did none of the stuff. I did none of that chemo radiation that you say, yes, I did the protocol. I get checked to make sure, but I didn't do any of the other stuff. So that's where I thought to myself, what are you saying? What you should say is, yes, women, just be mindful. You know yourself. Like you said, if your breast starts hurting, there's a lady actually, she's in, I'm speaking to her lately. She's in, where is she? She's in LA. Her breast is swollen. She can't bend forward. It's so much pain. Um, there's no discharge or anything, but she's in a lot of pain. She's had the ultrasound, mammogram, um, what's the other one? She hasn't had the MRI yet. She's had all these tests and they've come back saying it's negative, but she wants to find something. And I'm like, well, my hallucination, my opinion, I actually said to her, did you take the vaccine? And she said, yes, yes. And I was thinking of taking the booster because I work in the medical field. And I remember saying to her, just stop for 5 seconds. Just stop. Because it's possibly not breast cancer, but it's destroyed your hormones. Who knows what's happening in your body that all of a sudden your breasts are aching. She's not getting her period, things like that. So it's gone from, hang on, you gave me your results. They're not breast cancer, according to them, which is great news. But let's not ignore it because something's happening in your body. So when I said to her, did you take the vaccine? And she said, yes, I did. And I was thinking of taking the last booster, which I don't know what number we're up to. I just said, please don't. I mean, as a human being, I actually just said, please don't do that. Please don't do that. And please see a doctor now who's going to get through and say, oh, this is your vaccine injury. It's not breast cancer. Thank goodness for that. But don't write off everything if it's not breast cancer. It could be something even more sinister or less sinister. I don't know. But it's gotten to the point where, and that's the other thing I was going to bring up too, when the COVID vaccine first came out, I don't know if it happened in Canada, when I was going for my routine checks, the first thing they would say to me is, did you take the vaccine? When I would say no, you hear that grunt on the other side of the phone. Couldn't care. But thank God for that. Because why? Because all of a sudden, women's lymph nodes were swelling and they were doing biopsies on their lymph nodes thinking it was cancer. So women went through unnecessary biopsies because of the COVID vaccine. And this is a true story. Then they started saying, did you get the COVID vaccine? Because if you did, you're going to have to wait 4 weeks before you come for your scans, because they were misdiagnosing women with breast cancer. Yep, your lymph nodes swollen, must be breast cancer. I had swollen lymph nodes. You got a swollen lymph node? Yeah. Well, I did have the flu about a week ago. Oh, did you? Yeah, I did. Oh, but we got to still check it. But I had the flu. Oh, yeah, no, your lymph node's normal now. Okay, like no biopsies, but I'd go like 3 months to do an ultrasound. Oh, yeah, it's all normal. But it's really important that women know, if you feel good about yourself, great. But have you had this particular vaccines or other vaccines? Just be mindful because, like you said before, it's causing so many issues. Imagine that. Imagine knowing under the telescope, is things like parasites. You're trying to prevent that stuff from entering your body, and they're putting all this stuff. And I've heard of a lot of things. I've heard of metal. I've heard of mercury. I've heard of a lot of things in the vaccines. And I'm again, I'm just listening to what others are saying. I didn't do the homework. Um,
Does
so
it great,
I
Sorry to interrupt. Does that surprise you when I say there's potentially parasites in the
Oh
vaccine?
my goodness, it does. Because
Hmm.
you're trying to prevent it as a human being. You hear about parasites in your stomach. You hear about it in your gut because they say that most things also start from the gut. So you have a healthy gut. So you sort of hear of all these things, trying, how do I eliminate that? And then you're hearing that the vaccine's bringing it in. It's like,
Well, I mean, why such a push on the vaccine, right? It was a push to make the hu humanity sick, and I
correct.
do believe we're in a genocide. I mean, there's nothing healthy about what's happened in the past 5 years. So, that it would make sense that they would have, you know, uh, laced the vaccine with something very harmful, and again, just to alter, our DNA, get into every cell of our body. And that's part of, what we've been seeing the ivermectin do is it helps to unstick the red blood cells. So it really focuses on the red blood cells because the vaccine is an inflammatory ingredient. And when you have that, you have clumpy red blood cells, which prevents oxygen from crossing from one blood cell to another. So you have a lack of oxygen in your body and specific tissues. So ivermectin seems to be unclumping the red blood cell, getting better oxygenation, and then, that's where you have better perfusion. So it's, and these lymph nodes that are swollen, yeah, your lymph nodes are part of your immune system and they're angry. Your body's angry, so your lymph nodes are going to be angry and swollen too. So again, I think the biopsy is the wrong intervention. It only makes things worse. Now you have this open gaping wound with potential for infection. And do you really even have more of a better story than you would have before? I don't think so. So, I know a lot of, physicians are very pressuring, women. If you don't do it within 7 days, I'm not going to see you. So these women are feeling so pressured, and it's hard to make an informed choice when you're under so much pressure. So just take a nice deep breath, relax. You might have had this lump for a long, long time. Things often, if you just wait them out, they do this heal themselves. So we don't need to be super super hasty on an unnecessary intervention with unexpected recovery situation.
Yeah, that's so true. Just wait, just like I said, take a deep breath and just sit back for a minute, So that is really important. Now, is there anything that we haven't touched on that you might want to, share with our viewers and listeners today that we didn't sort of touch on? Anything that we might have missed?
I'm just with my tech guy Tyler here, and as I'm just sitting here, I really have been wanting to reach out to Australia and be able to offer ivermectin and fenbizole and mebendazole and other, and vitamin D. And
Mhm.
maybe there's parts of Australia that need vitamin D. But I want to be able to offer, what we have here at Ezra Healing to Australians. That's been on my list because there's, about 5 countries that were so targeted, Canada, Australia, UK, New Zealand. I really want to just invade these countries with healing solutions. And Grace, you've been such an angel and an answer to prayer to talk to because Australia's been on my heart. So, I'm just thinking here, how can we help people in Australia get what they need when they need it without barriers? Because that's what I'm all about is getting from A to B, and getting right into your house when you need it. No wait times, no negotiation with your physician. Like, it's just boom, you get the product. So I want to offer this to Australia, and it would be shipped right from India. It won't be shipped from, anywhere. We'll go right from India to Australia. And on my website, ezrahealing.com, you can go and order ivermectin
Mm.
We'll make ivermectin and mebendazole accessible, and these are cancer healing medicines. So they're, we just talked about them. Do some more research on them. But the vitamin I is the ivermectin. Vitamin I, vitamin M is the mebendazole. I've had to have some code names
Mm.
because our government isn't like truly supportive of healers like me. So we talk in code a bit until we can, totally come up. But if you are sitting there in Australia hearing this and you want to order some ivermectin, to say try to see if it's going to be effective for breast cancer or a vaccine injury. And again, I know we're focused on breast cancer today, but there's all types of cancer that ivermectin and mebendazole are good for because it's the same thing. These are antiparasitics, whether it's brain, breast, bowel, colon, prostate, multiple myeloma, um, skin cancer. So it's really worth a try of these medicines. We also offer nursing consultations that we can, offer you, and we can help you dose it out. But it's something that I think, if you don't have in Australia, it's just a nice option to have. So, EzraHealing.com, go to our products page and you can just order it. The addresses should prompt for Australia. If they don't, you can just reach out to us either via email, probably is the best way. Or our website has a chat on there. You just put in your question and it comes to a real person. We don't deal with AI at the moment. We're really trying to get back to human connection and good old fashioned healthcare where you talk to people who've been through it all. We're very, very busy because the world is waking up. And it's an honor to be able to connect with you and talk with you. And, thank you for trusting us. We are just simple Canadians with healthcare experience trying to make a difference in our life and in your life. And it would be a pleasure to connect with people in Australia because really we are one. We are one consciousness waking up at the same time on the same planet. So I want to offer that to you, Grace, and your viewership today.
Absolutely, and I'll have make sure that I'll have all your links where people can actually click on it. I believe, like we were talking before, people need other options, and this is an amazing option for people to look at. There's not just the one size fits all for everyone, and your medical team. We're not saying to write them off, but please just make sure you work together. I remember telling my medical team, work with me. If I'm not doing anything, just keep working with me. I need you beside me. A blood test, yes, I need to get those done, make sure things are happening right. I continue to work with both modalities, and having these ones available. And again, I'm not too sure how things are in Australia because I know our friend she got hers from Egypt. Her friends brought it in from Egypt because I'm a bit worried with the Australian sort of the way that they sort of allow tablets and medication to come in. But we're not going against the grain. We're not bringing in something illegal. We're bringing something that works. So we'll work away. And I know that Svetlana will also work a way to get you to get these medications. And I know for a fact that if you have anything, any questions, you're concerned about anything, please reach out to, Ezra Healing. Reach out to the people there and say, look, this is my journey. What do you think? How can this help me? Please do that. And make sure that you reach out to the right people. And I would probably I put I'll put my hand on the fire because you've had 25 years of experience in the medical field. So that's where I would put my hand on the fire and say, guys, trust this platform, trust them, because they know they've been there. I love working and listening to people that have been on both sides of the fence because you know better than anyone what it's really like to be on both sides. So I really thank you for that. I thank you for sharing so much about, all of these ways that we can open up and really start healing ourselves. Like you said, it's not just a physical awakening, it's a spiritual, it's an emotional, it's a psychological awakening. And, we're human beings and we're trying to have human being experiences. Why not live your best life? Why not? And unfortunately, due to certain foods, environments, whatever it is that can create these diseases, why not try and eliminate them before they become diseases? Or if they have become a disease, let's go back to the good old-fashioned ways of, you know, healing ourselves and not just feeding the big pharma machines, as I call it. So, but again, this is us, this is our disclaimer, and we're here to share that with you guys. So thank you. Thank you again for being on my podcast. It's been an amazing podcast. I've written so much in these 3 pages of yours, that for myself as well, just so I can better understand and help women going forward. So thank you again for being on my podcast.
Grace, you are one truly beautiful advocate, and I have a special place in my heart for advocacy work. You don't have to be doing what you're doing to the level you're doing it, but you really feel the calling. And I think we can't talk about this enough. This will never be boring. This will never be a broken record. We just need to keep talking and talking and talking, because we speak this into existence as we talk. And when we come out here, where two or more are gathered, Grace, there's a lot of power and healing that we get to push out. And what you're doing for your people and other people who hear this across the world, you are impacting, and you are going to save that life. You are going to make that difference. And it not only does it feel good, but it is good. It's good for our health, because we're in this giving and receiving ship mode, and as much as we receive, we should be giving back, I believe. So to whom much is you know um given, much is expected. And you have been really put in an honorable place, and you use your platform to the best of your ability. And I thank you for using your platform for the good. We see a lot of media people, or just in the history, media in general, who have really abused that media platform. And I love how the new media is really turning around, and it's independent journalism. So you're such a beautiful soul to me, and I look forward to meeting you in person one day. Thank you so much.
Absolutely. I can't wait as well. And thank you so much for that. I feel really humble, but I always said that, you know, my husband says it actually, it's that what we have is meant to be shared and not kept for ourselves. So I feel that I'm at service, I'm there to be at service any way I can for the good of all, we say. So thank you again, and thank you so much for sharing what you have, and empowering our listeners and our viewers today. I'm sure you've left a mark on them. You've left a seed. Please, guys, reach out to them. I'll make sure that every link possible is available, and definitely we'll meet. We'll catch up absolutely in person, whether you come to Australia or I come to Canada. But I thank you again. And I thank everyone else out there. And like always, I send you so much love and light.